Hello, my name is Dana Gavino and my topic is HIV infection with AIDS and Pneumocystis pneumonia. First, we have the definition. Pneumocystis pneumonia is a serious infection that causes inflammation and fluid buildup in the lungs. It is caused by fungus called Pneumocystis jirovecii. Unhealthy immune system can easily control it, but it causes a type of pneumonia in people with a weakened immune system, such as those with HIV. This is what is called an opportunistic infection. Here we have a video.
Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for the patient with HIV/AIDS-related Pneumocystis pneumonia, the most common infection in people with HIV infection and AIDS. In this module, you'll learn what's involved in caring for a patient with Pneumocystis pneumonia and how to deal with common patient questions and concerns. We'll begin with the report from the nurse coming off duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations.
Hey, Angela. How's it going?
Hi, Alana. I'm good. How are you?
I'm doing good. Are you the next nurse for Ms. Robbins?
I am. You want to tell me what's going on with her?
Let me give you the situation. Jasmine Robbins is 34 years old, no known drug allergies. Eric Stevenson's her doctor. Now, 3 days ago, she developed a mild cough, but last night before bed, she felt very short of breath and came into the ER.
And what did she look like when she came into the ER?
Let's see. On admission, her vital signs were temperature, 100.8 degrees, heart rate was 106, respiratory rate was 26, and blood pressure was 110/70. Her oxygen saturation was 90% on room air. Now, in the ER, her chest x-ray revealed bilateral infiltrates. Let's see, she got a sputum culture, blood culture, CBC, and a Chem 7 panel. They all got completed, and they suspect a diagnosis of PCP.
Pneumocystis pneumonia.
Right. As a result of these findings, they started her on, 2 liters humidified oxygen by nasal cannula. We got D5 half normal saline going at 100 milliliters per hour through the right forearm. And let's see, trimethoprim sulfamethoxazole at 5 milligrams per kilogram IV. Now, the first dose was given at midnight in the ER, and then they gave her prednisone at 40 milligrams orally twice a day. That first dose was given at 10 p.m. in the ER. Now, in addition to all of that, she was also prescribed acetaminophen, 650 milligrams every 6 hours PRN, and looks like hydrocodone syrup, 1 teaspoon every 8 hours PRN. Let's see, her past medical history, it looks like she believes she became HIV positive about 10 years ago when she was heavily into IV drug use. Now, she tested positive for HIV 5 years ago, and she got clean then, and she's been on HIV medication ever since then as well.
So I'm going to presume we're keeping her on her HIV medications when she's here?
Absolutely.
Can we go over those now?
Sure. She's on Combivir, 1-tab PO-BID, and Crixivan, 200 milligrams PO-TID. Now, reviewing the systems, neurological, she's awake, alert, and oriented ×3. Cardiovascular, her heart is regular with no adventitious sounds. The IV of the D5 half normal saline at 100 milliliters per hour is infusing into her right forearm. Respiratory, Jasmine's really short of breath, and she gets fatigued with any activity. Her lung sounds are decreased bilaterally, and she has a productive cough of thin whitish mucus. Now, with the 2 liters of humidified oxygen, her pulse ox is 94%. Gastrointestinal, she hasn't really eaten since she's come to the floor, but she reports a poor appetite lately. She denies any diarrhea. Genitourinary, she voided a small amount of dark amber urine, and when I helped her to the bathroom, she was really short of breath, so we took a lot of rest stops on the way. There is a commode head in the bathroom that we're using to help record her INO. And integument, her skin's clean, dry, intact, no areas of breakdown noted.
So, going forward, what are your recommendations?
Well, during the day, I'd recommend keeping a close eye on her respiratory status. As I mentioned before, she becomes really short of breath when she performs almost any activity. We'll also need to promote pulmonary care by encouraging her to use the incentive spirometer. We also need to watch her nutrition and fluid status. It doesn't sound like she was eating or drinking a lot prior to coming into the ER. Now, she has been started on IV fluids, which should help, but we still need to encourage her to eat small, frequent meals to keep up her nutritional status.
Got it. Thanks, Alana. Are you heading home now?
Absolutely, on my way out the door.
I'll see you tomorrow.
Take care.
You're about to watch a registered nurse conduct a focused assessment of a patient who has HIV/AIDS-related pneumocystis pneumonia. Note how the nurse performs each step, and just as important, how she explains what she's doing to help the patient understand what's being done and why. In any assessment, the first step is to wash your hands, introduce yourself, and check the patient's ID band.
Hi, Miss Robbins. I'm Angela. I'm going to be your nurse this morning, so I'm just going to wash my hands and then we'll get started with my assessment, okay? How are you feeling?
Very tired.
I bet. I just have a few things to do this morning, and then I'm going to let you rest for a little while, okay?
Okay.
But before I get started, I'm going to check your ID band. So, can you tell me your full name and date of birth?
Jasmine Robbins, October 12th, 1975.
All right, well, that checks out. So now I'm going to start with your vital signs. If you have any questions while I'm doing this, just let me know, okay? First thing I'm going to do is take your temperature. Just go ahead and put this underneath your tongue. Close your mouth. Great. 100.0. Which is still a little bit elevated, but better than last night. And now I'm going to take your blood pressure. You just place this cuff underneath your arm. It's going to get a little tight as I squeeze it up. Great. (116/68). Okay, I'm just going to check to make sure that your oxygen is set properly and that there's enough water in the bottle. Okay, that's good. Okay, let's check your heart rate and your respiratory rate. Your heart rate is 92. That's good. That's come down a bit. And your respiratory rate is 24. Is it feeling any easier to breathe today?
A little bit. I get tired quickly.
I bet. I'm going to check your oxygen saturation with this pulse oximeter, and it basically tells me how much oxygen is getting into your tissues. So I'm going to put this little clip on your finger. Okay, 96% on 2 liters nasal cannula with humidification. This is all good. You're definitely doing better than you were last night. Next, I'm just going to do your cardiovascular assessment, and in order to do that, I'm going to need to listen to your heart sounds from underneath your gown. Is that okay? I'm just going to shut the door first.
When performing a cardiac assessment on a patient with HIV/AIDS-related pneumocystis pneumonia, listen to the 5 areas of the heart, checking for any abnormal heart sounds. These patients are at a higher risk for developing heart disease. Be sure to document the heart rate and rhythm after your assessment and notify the doctor about any abnormal sounds.
I'm just going to reach underneath your arm here. Now there's just one more sound that I need to hear, and in order to hear that very clearly, I'm going to need you to roll over just a little bit on your left-hand side, okay? Okay. Thanks.
When possible, assess the PMI with the patient lying on the left side, as you see here. This positioning makes it easier for you to hear any abnormal sounds.
Okay, you can roll back now. It sounds good, your heart sounds normal, and I don't hear any unusual sounds at all.
Oh, that's good.
Ms. Robbins, now I'm going to do your respiratory assessment. It's going to help give me a little bit better picture of how well you're breathing. So I'm going to use the bed to help you sit up a little bit. First, I'm going to listen to your lungs from the front and then from the back, okay? But I'm also going to need to go underneath the gown again with my stethoscope. Is that okay? Take some deep breaths in and out of your mouth. I'm just going to need to reach over here. Sit you up so I can listen to the back. Are you okay? It's not unusual for you to take some deep breaths and cough a lot right now.
When performing a respiratory assessment on a patient with pneumonia of any type, it's not unusual for the patient to cough when asked to take a deep breath. If this happens while you're trying to auscultate the lungs, lift your stethoscope from the patient's skin until he or she is finished coughing. After the coughing subsides, reassess the patient's lungs.
Okay, just one more. Go ahead and sit back. Your lung sounds are decreased bilaterally. That means both sides. That's due to the suspected pneumonia right now. And like the coughing, it's not unusual at all. You seem to get kind of short of breath, though, with this activity.
Yes. And I've been coughing a lot.
That's good. Coughing is very important right now to help clear up some of those secretions, but coughing can really be exhausting also for you right now. So if for any reason you feel like you're getting tired from the coughing, just let me know. I'll come in, I'll bring some cough syrup, and that will help relieve it, okay? Why don't you rest for a minute, and I'm going to explain another activity that's going to help improve your oxygenation, okay? It's called incentive spirometry. And to do it, we use this device called an incentive spirometer. It actually helps to teach you how to take deep breaths, okay? I'm going to show you how to use it, and then you're going to try it yourself. Deep breaths are going to encourage good air exchange with your lungs, and it's also going to help clear up those secretions that are interfering with your breathing. So you're going to hold the device in one hand, the mouthpiece in the other. You're going to exhale completely, put the mouthpiece in your mouth, take a deep breath in, hold till 3, take the mouthpiece out, and then breathe normally, okay? Do you think you can try it now? Here you go. Okay. When you're ready, exhale completely, put the device in your mouth, take a deep breath in, count to 3, take it out, and breathe normally.